Good afternoon. My name is Michelle McAllister. It is May 2nd, and here is my card. Today, I would like to talk about two different cases that we're going to be looking at. The first one, a 16-year-old female that is diagnosed with a deficiency of muscle glycogen phosphorylase, and the second is going to be a 2-month-old child who presents with a variety of different symptoms, and we're going to have to narrow down what we can diagnose. Good afternoon. My name is Michelle McAllister. It is May 2nd, 2021, and today I would like to talk about two different cases that we're going to be taking a look at. The first is going to be a 16-year-old who is diagnosed with a deficiency of muscle glycogen phosphorylase, and how we're going to approach that. And the second is going to be a case involving a 2-month-old child who presents with a variety of symptoms, and we're going to need to assess and see what we can diagnose. Our first case, our 16-year-old female, she has been diagnosed with a deficiency of muscle glycogen phosphorylase, which is an enzyme found in the body. She does have a variety of questions, and we're going to take a look at her questions and see if we can answer them. The first question was, I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? So my response to that would be, glycogen is a form of glucose, which is a form of sugar. Glycogen typically is not immediately used by the body following intake and can be stored in the muscle for later use. Glycogen also plays a role in blood sugar stabilization, but for now we don't need to get into that. When the body exercises, glycogen molecules are broken down into smaller glucose molecules with the help of the muscle glycogen phosphorylase enzyme. This is the enzyme that our patient is deficient in. The glucose is then transported into the bloodstream and used by the cells of the body. The second question is, I really like to take long walks. Will I still be able to do this with my friends? So what we've learned in this course, it does appear that she'll still be able to take walks with her friends. We would like them to be as least strenuous as possible. So I do think she'd be okay to take short walks at perhaps a leisurely pace. Strenuous walks for a prolonged amount of time may be an issue for this patient. If the muscles cannot utilize the stored glycogen due to the absence of the necessary enzymes, she might experience muscle weakness, tiredness, and pain when she's trying to go on these longer walks. My recommendation to her would still be go ahead and take walks, but listen to your body, and if you start to experience these side effects, know when to rest, and definitely bring some kind of snack just to keep those glucose levels up during her walks. The third question is, as a result of this deficiency, will I need to get up at night to eat to maintain my blood glucose levels? So this was the question that I did a little more research on than the others because I found some conflicting answers, but it looks like the short answer is no. She won't need to get up in the middle of the night to eat something. A well-balanced diet should provide her with the adequate glucose for her body to utilize while she sleeps. Since the issue here is that her body is not able to adequately utilize the glucose once it's converted to glycogen, since she's sleeping and she's not strenuously exercising, this should not be an issue. Glycogen is utilized during strenuous conditions such as exercise. As a precaution, though, I might advise the patient to keep maybe some kind of sweet beverage or a snack on her nightstand just in case she wakes up and those glucose levels do tend to drop at night. So the last question from our 16-year-old patient is, do I need to worry about producing excessive lactate during intense anaerobic exercise? This was another interesting question. It did not appear that our patient was diagnosed with McArdle's disease, which is going to be that blocked muscle glycogen breakdown. It does say she has a deficiency, so it leads me to believe that perhaps she has lower levels versus no levels. I'm not sure with the terminology, but some of the research paperwork that I did find was specifically regarding McArdle disease, and it was very thorough, so I'm using that data here. Lactic acid is produced when glucose is metabolized in an anaerobic environment. We do know that. The glucose concentration in the blood is rapidly depleted during exercise. So for a patient who cannot utilize stored glycogen in the muscle, excessive lactate production could be a cause for concern. Excessive lactate production could be painful. It could produce that burning, that tiredness sensation in the muscles. So it would be something I would worry about. But some of the research that I found regarding patients with McArdle syndrome, McArdle disease, are thought not to produce lactate during exercise. So while I'm not sure of this patient specifically and what she can and can't do, I would just, again, tell her to monitor her body. And while the research should suggest that patients with McArdle syndrome may not have to worry about this. Any pain, any discomfort while exercising, I want her to keep an eye out for. The second case that we're going to take a look at today is a 2-month-old female who presents with a variety of symptoms, including hepatomegaly, which is an enlargement of the liver, hypoglycemia, and cannot maintain blood glucose levels within a normal range during fasting. So there are a variety of diseases or conditions to look at with this child, but this child would likely be diagnosed with glycogen storage disease. Immediately, if I see that this patient cannot maintain blood glucose levels within a normal range during fasting, that's going to jump out of all of our choices. But the symptoms for glycogen storage disease include enlarged liver, which our patient did present with, low blood sugar level, which our patient did present with, and a high level of lactate, which can be seen when epinephrine is given if you have issues with glycogen storage. So that's something that immediately, those are hallmarks right there. I'm going to look at that as my option. However, other symptoms that could occur but were not mentioned in this case include impaired growth, bone thinning, and ulcers in the mouth. I have 3 other diagnoses here that we can take a look at, but they are going to be pretty easy to rule out. The first one that we're going to look at is going to be a hereditary fructose intolerance. The symptoms seen for this are typically vomiting, fatigue, and abdominal pain. None of these symptoms were noted in our patient. Since it is hereditary, this might be something too that the family would report when bringing in the child, which they did not. So safely we can rule out the hereditary fructose intolerance. Second diagnosis that we can go ahead and rule out for a patient is galactosemia. The symptoms for galactosemia are loss of appetite, vomiting, again, things that we are not seeing in this child, things that were not noted. So that's not something I would look at. It also does appear that this patient has been able to ingest these items. The blood sugar is just not staying at a rate that it should. So we can rule out galactosemia. Our third disease that we can go ahead and rule out is the glucose 6-phosphate dehydrogenase deficiency, which I've shortened to G6PD deficiency. Again, you look for certain symptoms with this deficiency: dark urine, jaundice, which is yellowing of the skin and eyes, that abdominal pain. None of these are reported by our fictitious family with our child, so we can go ahead and rule that out as well. None of these diagnoses fit as well as the glycogen storage disease, and the hallmark here seen with the administration of the epinephrine with no increase in blood glucose but an increase in the blood lactate, along with the other recorded symptoms. If we are looking at this bank of choices, out of the 4, the glycogen storage disease makes the most sense. I'm sure there are a variety of other instances that could have caused these side effects, but for our purposes today, with these 4 conditions, our best bet is to go ahead and diagnose our patient with the glycogen storage disease. So that is going to wrap up our review of our Unit 2 case questions. Thank you for following along. I hope everything made sense. And I will see you in Unit 4 for our next video case connections. Thank you.